extra spots, guys. Well, good morning, everyone. And today we're very pleased to be joined by Gord Wyant, our Saskatchewan Party candidate for Saskatoon Northwest, as well as Rylan Hunter, our Saskatchewan Party candidate for Saskatoon-Meewasin. And we have with us today Paul Merriman, our Saskatchewan Party candidate for Saskatoon-Silver Springs-Sutherland. Also joining us today is Naren Gillies, who is the Executive Director of the Saskatchewan Deaf and Hard of Hearing Society. Thank you for joining us here this morning, Naren. We have Sue Schmidt behind me, who will be our American Sign Language, our ASL interpreter for today's event. Also joining us today, we have three very special members of our Saskatchewan community. We have Nicole Musey, we have Patricia Spicer, and we have Rochelle Carty-Bauman. Thank you for joining us today. One other person joining us here today that I would make special mention of, I haven't had the opportunity to see her as much as I normally would like to over the course of the last couple of weeks, but is my wife, Krista, and I'm very happy that she is able to join us in Saskatoon here this morning. As you have heard me say many times throughout this election campaign, the Saskatchewan Party has a plan for a strong economy and for a strong Saskatchewan. But we don't seek a strong economy only for its own sake. We want a strong economy because it provides the opportunity and the resources to improve the quality of life for everyone in our province. Since first coming to office in 2007, the Saskatchewan Party has been working to make Saskatchewan the very best place in Canada for people living with a disability. A better quality of life for everyone in this province. That's the goal. This is really the ultimate objective when we talk about the importance of a growing Saskatchewan economy. We want a strong and growing Saskatchewan so that we can support those that may need assistance. In our province, there are people who are both deaf and blind, people with combined loss of hearing and vision, to a point that neither sense can be used as a way of gathering information or as a method of communicating. It's quite difficult, I think, for many of us to imagine living without your sight or without your hearing. But put aside the disability, and these folks are like any one of us. They live full, rich, productive lives. They just need some additional supports. In the last provincial budget, the government provided a total of $350,000 to the CNIB and as well the Saskatchewan Deaf and Hard of Hearing Services, two organizations that do some absolutely fantastic work in our communities across this province. This funding was used to hire a deafblind intervener, an American Sign Language interpreter, and 2 sign support professionals. There was also an enhancement of the 24-hour interpreter line that is used by the deafblind community to include access to intervener services. And interveners are trained professionals who act as the eyes and the ears of our deafblind residents in Saskatchewan. This investment was a good start, but it was only just that, a start. During the next 3 years, a re-elected Saskatchewan Party government will provide more funding to the 2 organizations so that they may hire 3 additional deafblind interveners, 3 new American Sign Language interpreters, 1 additional sign support professional, and 1 new case manager. These additional services will cost about $1 million annually, and they will benefit about 150 deafblind persons across the province. In the larger scheme of the provincial budget, this is not a comparatively large amount of money, but it will mean so much to the people that will use those services. That is why we need a growing economy in this province. If our province is growing, if we are attracting investment, if Saskatchewan is creating jobs, we will have the resources to continue to make these types of investments into the future. We can build a growing Saskatchewan to ensure that everyone has the very best possible quality of life and feels truly a part of their communities. Making Saskatchewan the best place in Canada for people living with a disability, that's our plan. That's our plan for a strong Saskatchewan. Before I conclude my remarks here today, I'll just make a couple of comments with some of the recent events across Canada related to COVID-19. In the past few days, we have seen some alarming new case numbers in other provinces in this nation. We've also seen a few more cases right here in Saskatchewan. Saskatchewan people, in saying that, continue to do an extremely good job controlling the spread of COVID-19, and for that I say thank you. That's because almost everyone is doing a great job of following the public health guidelines that Dr. Shahab and his office have put forward. Almost everyone. There are a very few that are not. In recent days, I've heard a few reports of individuals that have refused to self-isolate after returning from international travel, from travel to other countries. And all of us have now heard and probably seen pictures of the recent full gospel outreach events, both in Prince Albert and in Beauval. And I saw those pictures, and I could say they were rather upsetting for myself and likely upsetting for many across the province. Because I know over the course of the last few months, there have been hundreds of worship services, hundreds, maybe thousands of worship services that have been held safely. They have all followed, the vast majority have followed the public health guidelines. It's upsetting to see the actions of just a select few people actually jeopardize the collective efforts of the overwhelming majority of Saskatchewan residents who are following the public health guidelines in order to protect themselves, to protect those in their community, and to protect their family. As I have said before, this virus does not discriminate who it infects. Given the opportunity, it will spread. It will spread quickly among groups of people, in particular those that are not following the public health guidelines that are put in place for our safety. I know the Saskatchewan Health Authority is investigating and they're looking at levying fines in these cases. If this happens, we will certainly support that decision. But listen, the goal is not to fine people. The goal is for everyone to be safe. The goal is that everyone will follow the public health guidelines because they work. And that means everyone. No one is exempt, not one of us. So self-isolate when it's required and follow the restrictions on gathering sizes that are put forward. To do anything else is, quite frankly, nothing short of selfish. And selfish is not the Saskatchewan way. The Saskatchewan way is that we look out for one another. We protect one another. We've done so very well thus far. Please don't be one of the selfish individuals who, his reckless actions, put everything that we have collectively achieved at risk. Thank you, and I'd be happy to answer any questions that may arise.
Hi, Mr. Moe. I'm
Yes.
wondering which of these announcements today what will be made available to people in rural areas?
These examples here today?
Yes, of the interpreters.
Naren, or Paul or Naren, do you want to speak specifically to the geography of where and how these services will be made available?
Thank you, Premier. That's okay. Thanks for the question. These services are based out of Saskatoon, but they'll be impacting people across the province. The team that's over here is, I was just speaking to them, they're traveling day and night to go make sure that rural Saskatchewan is included in that. And if anybody needs to travel into Saskatoon or into the major centers, they will be able to meet with them. But we're also using technology, and we're leveraging that technology. I was just watching a video just before where they're sending it out to individuals with small children that have school books where there is an interpreter right there on the video screen to be able to interpret what is being written or what is being read in that book. So there's many accesses for people all across rural Saskatchewan as well as up into the north.
I'd like, Naren, would you have something to add to that on how the services are accessed? Go ahead. Come on. Go ahead and interpret for me. Yep.
We are doing a lot of things remotely. We're mostly out of Saskatoon and Regina, but there are kids all over our province who have no access to language, and some people don't have access to the internet. So we're looking at different ways of providing access to them. You know, if we can have Zoom meetings, like right now we're working with the preschool, and what's really neat is we're developing packages so that there's access to American Sign Language, since it's something near and dear to us. And thank you very much, Premier Scott Moe, for that allocation of dollars, and it's really important because we want to work on our younger generation and making sure they have language access. Once again, I mean, American Sign Language is a language, and some kids have no language whatsoever, and it's really important that they have access to it, however we provide that. I'm not sure if I need to add anything to that.
Thank you very much, Nicole.
And if I may ask another question, today is World Mental Health Day. I'm curious if you can expand on what your platform does for mental health and addiction here in the province. I know you've touted the treatment center in Estevan. I'm curious more about if there's any support going to frontline workers, especially as we're in the midst of an overdose crisis with close to 40 overdose deaths, confirmed deaths, and then I think we're at about 120 suspected overdose deaths.
Right, absolutely. As we go into, and we talked about this a little bit yesterday with respect to the broader conversation around not only addictions leading to overdoses, but the often associated mental health challenges that we have. I think Jim Ryder had spoken yesterday that our last budget was up, I believe, about $30 million, one previous about the same. Investments that we are continuing to focus on outcomes in mental health addictions across the province. We mentioned the crystal meth treatment beds that we have opened in Estevan recently this last budget. I think I mentioned yesterday as well the urgent care centers in Saskatoon and Regina that we're looking at will have a mental health component to them, to mental health and addictions component to really be the front line of expanding that access point for those into accessing the supports that we have across the broader spectrum in mental health and addictions here in the province. There has been over the course of just this last budget, out of the investments that we made, about $6 million that went directly into addictions specifically, and I mentioned the crystal meth treatment beds in Estevan. There's also 27 new detox beds that have been spread over a number of other communities. So there's staff and increase in services in Regina, in Saskatoon, in Prince Albert, in Moose Jaw, and in North Battleford into the detox beds that we have in those communities. So expanding the service that we have there. Just under $1 million was put into hiring additional addiction workers to better resource our emergency departments in Regina, Saskatoon, as well as in Prince Albert. And this is where those urgent care centers and the mental health component of those urgent care centers will start to overlap with our emergency departments as an entry point. This is an area of healthcare that we have discussed much over the course of the last number of years. I would say we're going to continue discussing it at likely an accelerated rate over the course of the next number of years, and it is going to require continued accelerated investment, an investment that will have to partner with community-based organizations, partner with communities, quite frankly, to ensure that we are focusing on and achieving the outcomes that we have. The challenges that we're facing in the way of, you use the example of the overdoses that we are facing, overdose deaths that we are facing, are not exclusive to Saskatchewan. Those are challenges that we're facing across this nation and in many cases across North America. We need to continue to work together on addressing how we can continue to address this broader conversation. I agree.
Which community organizations are you partnering with?
We partner with numerous community organizations. At each and every budget, as we invest, we continue to partner with numerous community organizations across the province, and that will continue.
Thank you.
Just like to touch on the increased COVID numbers that you mentioned earlier. Just wondering, even here in the city on Thursday, they put out a notification for an increased COVID exposure. Hospitals adjusted their protocols and PPE accordingly. I'm just wondering if it makes you think about other measures you might have in your back pocket or even mandatory mask policy, things like that, to try and get a better handle on things.
So we are watching the numbers very closely, not so much in an eye to increase masking policies, and we've been clear with our masking policy since day one. If you can create that physical distance, a mask may not be required, but if you are inside that distance or in any way feel that you should have a mask. I carry one with myself all the time, and when I am required, I put that mask on. Listen, the public health parameters, the public health guidelines that we have in place, they work. They work very well. We've seen our numbers fluctuate between a low in around 50 or even lower, our infection numbers, and they've gone up close to that 300 range when we've had a few localized outbreaks that have occurred in simultaneously. But virtually all of, not all, but virtually all of the outbreaks that we have can be traced back to someone or a group of people that have violated the public health orders or violated the public health recommendations that are in place. And that's why I say when the vast majority of people in this province are doing so very well in ensuring that each and every day they have altered their life to some degree so that we are stopping the spread of this virus, or most certainly slowing the spread of this virus. And then you have a select few from time to time, and we've seen a select few here recently, and we may in the days ahead as well, that have violated those public health orders and then have caused an outbreak in their community or in their contact circle. The numbers that we have today are not different, I guess, from a traceability perspective. We can track most of the infections that we have today back to a point, which is very, very helpful, and as Dr. Shahab has said numerous times, is not a cause for alarm as long as those numbers continue to not be very high. In saying that, one of the numbers that I follow quite closely is our hospitalizations, and over the last few days our hospitalizations have increased. We have 8 and actually 2 in ICU, and that is a number that we need to be very, very careful of, as that is ultimately where we get into the number that we don't want to talk about in the way of fatalities. So there's not, I would say, active consideration around increasing measures. There is active consideration all the time around enforcing the measures that are in place. And we may see some of that in the days ahead. We will see what public health does with the orders that they have in place, and we would support if they move with fines or other measures that they have with those select individuals that have chosen not to obey the public health parameters, the public health guidelines, but also the public health laws that have been put in place. This maybe is just a quick opportunity to speak to something else. We continue to open up sectors of our community and our economy. Our Reopen Saskatchewan plan is a living document and continues to move along, most recently with opening up some youth recreation opportunities in the way of hockey. And that is, I come from a small rural Saskatchewan community. I know the importance of the hockey arena, and I have a number of nephews that have asked me when they would be able to play hockey. If we were ever to get into a challenging situation with our numbers here that we weren't able to trace back to a specific violation of the public health protocols, or if we were, when you look at the sectors of our economy that we have opened, when you look at the fact that we have opened up vast sectors of our community, we've opened up our schools. And now we're able to actually get into areas, because Saskatchewan people are doing so very well with their everyday behavior, we're able to actually we're moving forward with opening up youth recreation opportunities like hockey, where they can play other kids from other communities. If we got into a challenging situation, it isn't going to be schools or the sectors of the economy that we're going to go to first. It's going to be those recreational activities, those types of things. I would just say that. And so I would just reiterate to everyone in the province, this is a time as we come indoors, the weather is cooling down, we're coming indoors more, to pay attention and to reevaluate what you're doing each and every day to ensure that you are protecting not only yourself, but you're protecting your family, your community members, and you're protecting the opportunity that all Saskatchewan residents have in doing the things that we enjoy doing, like our children playing hockey.
With all that in mind, I guess, would you like to see, more fines handed out then to really drive that message home?
Where they're necessary, they will be handed out, and I trust that public health will make those decisions as they arise today and into the future.
Awesome. Thank you.
Thanks, everybody. That was a short answer to a very long question.